Hello. Welcome again to my channel. Yes, nice to see you again today. Please hit that like button and please do consider subscribing to my channel if you want to get useful advice about your health and about your wealth and daily motivations. Hi, so back to the topic of today. I'm going to talk about infertility. This is a very difficult topic, and unfortunately quite difficult to deal with. Infertility. Why can't I have a baby? So what's infertility? Infertility is when a couple cannot get pregnant, having intercourse, regular intercourse, for up to 1 or 2 years. If there's no sign of a positive pregnancy test, then within 1 or 2 years, then you will be, having infertility. Infertility is not just a woman's fault, because it takes a man and a woman to make a baby, a man and a woman. So it could be, man's fault, it could be a woman's fault, it could be both partners' fault. So people shouldn't just blame the woman, oh, it's your fault that I don't have a baby. No, man, check yourself too. So, if you have been, with your partner and you are below the age of 35 and you haven't been able to fall pregnant within 2 years, please do go and see a doctor. If you are above 35 years, please immediately go and see a doctor within about 6 months, because you need to have tests done, you need to have treatment done. And the earlier you start, the easier it is to, hopefully get your baby. But the longer one leaves it is more difficult. So, the eggs in the lady, they have been there since the woman was born. So if a woman is 36 years of age, her eggs are 36 years old. So, the younger eggs, they actually can do better. But I'm not saying I'm trying to be ageist, but, this is nature, unfortunately. Nature has made it this way. So the younger eggs do better. So please, if you are thinking of having a child, it's better to do it sooner rather than later. A lot of fertility specialists have come out, especially recently, on the newspapers, asking women not to postpone getting pregnant, because the longer you leave it, it can become more difficult for you to get pregnant. So there's 2 types of infertility. There's primary infertility and there's also secondary infertility. Primary infertility is when you haven't had a baby or haven't had a pregnancy at all. And secondary is when you've had a child or you've had a pregnancy, but you're finding it difficult to conceive again for the next time. So that's secondary infertility. So with everything infertility, the doctors, when you go to see your doctor, you need to have investigations, various tests done by the doctors to find out the cause of the infertility. The man will have to have very important, you men out there, your sperm test analysis. Please, men, because I've had so many men or women complain to me that, oh, their man doesn't want to go and have a sperm test done because he says it's the woman's fault. No. Please, man, you have to go and have your sperm checked, because sometimes the fault can be from you. I've seen men out there who have had, no sperms or low sperm count, and the woman is she's normal. There's nothing wrong with her, So you may be the cause of the problem, not just the woman. Woman, you have to have tests done, your hormones, because the woman's fertility is quite complex. You have hormones, you have the womb, so, and all these things interact. So you have to have hormonal blood tests, a long list of hormonal blood tests, and also you have to have your womb checked. You have to have your womb ultrasound scan as a basic, and then secondly, the womb the tubes can be checked as well. The tubes can be checked as well. So those are basic infertility workup. But I mean, if you have a good doctor, they should be able to point you in the area of what to do. When people have had their wombs checked, they've found out things like fibroids, ovarian cyst, endometriosis, and even sometimes sexually transmitted diseases can cause infertility. So, that's why it's very important to have your womb checked out. It's important to have your womb checked out. And based on what they find, for instance, if it's fibroids, because a fibroid, depending on where the fibroid is, if the fibroid is inside the womb and is blocking, it is, protruding into the womb lining, it can hinder, implantation of the embryo. So that can stop pregnancy. So fibroids have to be removed. Very, very important. They have to be removed. If the tubes are blocked, if they can't be sometimes some surgeons can do surgery to, repair bits of the tube. But at times, if they're too damaged, they will just tell you to go straight for the IVF treatment. And the IVF treatment is quite specialized. You have to go and see a consultant, fertility specialist, especially in the UK. You please do check on the website www.hfea.org.uk to be referred to a fertility specialist. It's better to check that website so you can see the league table of the hospitals you're going to, because you don't want to go to a hospital where unfortunately they have a low take-home baby rate. And especially if you're older woman trying to conceive, you don't want to be referred to a center where the take-home baby rate is low, and then you spend all that money on IVF, and then you have to eventually, keep on trying for the IVF and waste I think in the UK at the moment, I think you're allowed 2 goes. But if you're an older woman, unfortunately, once you hit the age of 40, you are not allowed to have IVF on the NHS. You're going to have to pay for your IVF, which is means in vitro fertilization. So these are things to consider when you're looking for trying to conceive. So speed is of the essence. Speed is of the essence. Please, as I tell my women patients, don't be fobbed off. When you think there's an issue, please go to your primary care physician or your GP and insist to be referred. I've seen women whose GPs have fobbed them off and, kept them, saying, oh, there's nothing wrong with you. It's going to happen until they're almost hitting the age of 36. And then, it's getting too late. NHS cutoff is 40. So what are you going to do? So please don't be fobbed off. If you haven't conceived within 1 or 2 years, you need to have yourself checked out as soon as possible. You and your partner need to be checked out as soon as possible. So things that cause infertility also are when people can't ovulate properly. As I said, low sperm count, blocked tubes, or endometriosis. Endometriosis and fibroids, especially for people that have color. I'm going to have a video about fibroids. I'm going to do a video about fibroids very soon to talk about fibroids. Fibroids are a big issue, especially in women of color. Fibroids is a very, very big issue. And, we need to, be aware about this problem and the effects it can have on our fertility. So what are the risk factors for infertility? As I said, age. You need to, as I said before, please don't be fobbed up by anybody. Once it's an issue, 1 year, there's no baby, please go and have yourself checked out. Weight. Being overweight as well can hinder people from conceiving at times. Sexually transmitted infections, smoking, alcohol, and also stress. When people are overstressed about not conceiving, that can also hinder fertility as well. So I hope this has helped you. Please, as I said before, the take-home messages are: don't leave it too late. If you suspect something's wrong, please do get checked out by your primary care physician or your gynecologist. The baseline tests are quite easy to run. Any primary care physician can run those baseline tests, blood tests for hormones, ultrasound scan, those can be easily done by any primary care or your general practitioner. Those can be easily done. So, I'm hoping that, you have success in your baby making endeavors, and I hope this helps you, and we hope to be able to celebrate with you very, very soon with your baby. Thank you, and I'll see you again in my next video.